This summer, I am completing a practicum through the UPMC Vision Institute's Community Initiatives Departments. So what that means is that I will be completing clinical research, which is patient-focused in both quantitative patient outcomes and qualitative patient interviews, experiences with the Eyes on Wheels and IVAN clinics through UPMC Vision Institute. So this summer, I will be working alongside these clinics as both a clinical employee and also an IRB-funded study, which essentially means that we'll receive funding for the Mid-Atlantic Public Research Center that's going to go towards establishing different barriers that patients experience in their hopes of obtaining equitable eye care, equitable access to eye care, and also understanding in regards to those barriers, what policy initiatives we can implement at both healthcare systems and also insurance and local governmental level. So the end goal is to construct both a policy brief and a manuscript that will describe these different barriers based on this quantitative and qualitative data, and hopefully implement a policy solution in a local Pittsburgh setting. This first year, I kind of came in not really knowing what I was going to learn. I think the most fundamental class for me ended up being a class I didn't expect to be the most fundamental, and that was microeconomics applied to healthcare. So I'm a neuroscience major by training and very science and medicine focused, and taking an economics class was kind of a step, and I thought a step to the side, and didn't really know where that was going to go in my professional career. But after taking that class, I learned the influence of insurance, the understanding of different markets, different Medicare plans that actually influence healthcare outcomes for patients. So in that class, we learned about different market failures and how those failures apply to the system and how you can implement solutions in both a financial and also policy way that can address those issues and improve patient outcomes. So that was a really fundamental class in my experience. I also found this semester in health policy management that being able to establish and implement and execute policy solutions is a really tangible thing to do, and even as a graduate student. So in working with the right organization, with the right people, conducting the right research, I was really able to deepen my understanding of policy process, not just from a legislative standpoint, but also from a healthcare professional standpoint. That for me meant working and gaining clinical experience to understand the situation from my own perspective, and then working with professionals in the field to apply a public health lens to talk with policymakers, talk with stakeholders to actually implement change. So I feel that my experience in microeconomics applied to healthcare and health policy management were most fundamental in my understanding for the practicum. My practicum is really unique to me because I was able to really customize it to what I was interested in. I believe that I'm maybe one of the few students who's pursuing a research-focused practicum with the IRB approval and also the grant I received. So for me, the practicum is really a culmination of my interest in medicine and clinical experience, but also my passion for health policy. So when I look back at the practicum, or I guess I look forward to it upon completion, I think that I'll have a really great understanding, maybe a deepened understanding of the different barriers, the socioeconomic barriers that lower income individuals, or maybe individuals who lack transportation, or older individuals, or with physical disabilities, the experiences they have in their pursuit of eye care. From this practicum, I really hope to really get feet on the ground and really be a catalyst for that policy solution. And although I know that the policy process takes months, years, long time to implement, I hope to lay the foundational framework to really see where that goes. I am passionate about pursuing medical school and becoming a physician. So upon completion of my MPH program, I hope to pursue medical school. And for me, what I really care a lot about is understanding the intersection between patient care and advocacy. I think that what I developed in my 4 years as an undergraduate student and my year in the public health program is my passion for advocacy and community outreach and leadership. I think that, especially in this practicum, I'm really able to see myself in that role, not necessarily as a leader, but as a change maker, and working alongside a team who's really made an imprint across the whole Pittsburgh community.